to teach that how you will get a history of patient presented in urology. ओपीडी आप यूरोलॉजी में बैठे हुए हैं, वहाँ पे पेशेंट आ रहे हैं, आपने उनकी हिस्ट्री लेनी होती है. सो देयर इज अ लिटिल डिफरेंस बिटवीन द हिस्ट्री, बिटवीन द कंप्लेंट्स व्हिच पेशेंट विल प्रेजेंट in the urological OPD or with the urological emergency. So you have to focus these things. ठीक है, let's start. How will you start? So again, history जो भी होती है, you have to start from the personal data, बायोडेटा, बेसिक डेटा से आप स्टार्ट करते हो. either you are taking history of the patient in medicine, either you are taking history of the patient in surgery or gynae, whatever. So first component of the history is personal data. This having importance, so you have to start with the personal data. Now if you are talking about the personal, you are sitting in the history, in the urology, and now you are starting with the personal data. You have to start from the name and file number. All these 8 components having its own important. We have to discuss each in detail. What is importance of the name, what is importance of the age, sex, religion, marital state, occupation, residence, date and time, and who gave the history. So let's start from the name and file number of the patient. So name is very important, as you know, by asking name from the patient, so it become easy for you to remain in contact with the patient. You will call him with his name and you will write down this for record purpose, which is mandatory in the OPD slip or in file of admission. So name and file number is most important in every patient, irrespective of the presenting complaint or irrespective of any department. So now next come age. What is importance of the age? Age की क्या importance है ना? So age, if we are talking about the urological symptoms, so recall your memory. What is importance of the age? Age की क्या importance हो सकती है? So you are sitting in the urological. So let me, I give you the example. Suppose a patient of 70 years, 70 years of age, presented in OPD of urology, and you are taking history. He's saying, I have a urinary retention, urinary hesitation, I have applying very force to pass the urine. Okay, this is one complaint of the patient having age of the 70. Now change the patient age. 20 years male patient presented to you with same complaint. ठीक है, complaint वही है. I am unable to pass the urine. I have feeling very difficulty to pass urine. ठीक है, I have to apply maximum force to start urination. So now by keeping age of these patient, you will differentiate the cause of these complaints. ठीक है, complaint वही है, एज सिर्फ डिफरेंट है. लेट्स वी आर टॉकिंग अबाउट दी 70 ईयर्स एज, तो आपके जिन में क्या आएगा? यस यस, यू आर राइट. आपके जिन में आएगा बीपीएच, benign prostate hyperplasia, BPH, which is more common in 60 and above age. Let's we are talking about the 20 years of the patient having the same complaint. What will be the problem? You will never think about the BPH. यू नो, आपको पता है कि बीपीएच तो 60 ईयर से हो जाए तो आप दूसरे काजेस की तरफ जाओगे कि मे बी ट्रॉमा हो, मे बी यूरेथ्रल स्ट्रक्चर हो, मे बी स्टोन इन्फेक्शन हो, मे बी कोई क्लॉट हो, वट एवर. सो तो there are the certain disease which are related to the age. Again, carcinoma of the prostate, carcinoma of the kidneys, they are related to the age. तो आपको एज की इम्पोर्टेंस पता होनी चाहिए when you are talking about the history taking in urology. And what is importance of the sex? So in sex, there is importance of the, so please recall, and whatever answer comes in your mind, you put in chat box. I am watching this. Okay, so what is importance of the sex in urological history? Yes, of course, if there is a male patient of 60 years age, you will think about the BPH. But if there is a female patient of the age 60 having the complaint of urinary retention, you will never think about the prostate because it is pure disease of the male patient. So sex having also importance. And religion, anyone of you may know about the religion? What is importance of the religion in urological history? Yes, write down in the chat box. Yes, the few religion it is mandatory for circumcision. Circumcision is mandatory in few religions. So a patient having a circumcision having least chances to have the UTIs, recurrent urinary tract infections. And now WHO has recommended that in certain areas of Africa where HIV or AIDS is more common, so they do selective circumcision to prevent chances टू हैव HIV और एड्स। ठीक है, तो ये भी एक है। तो रिलीजन पता होने से आपको पता चल जाएगा आइदर पेशेंट इज सर्कमसाइजेशन हो चुकी है उसकी, सर्कमसाइज्ड है और नॉट। ओके, what is important of marital status when we are talking about the urological history? Again, yes, there is, because कुछ डिजीज हैं जो मैरिटल स्टेटस में हो सकती हैं। कौन कौन सी हो सकती हैं? यस, द मोस्ट कॉमन STDs। क्या है? Sexual transmission disease. Sexual transmission disease, when patient, you will ask in history, he's complaining of the burning maturation and other problem, and you have asked from, are you married? He says yes. Then you have to think about the STD, sexual transmission disease. Again, occupation, yes, certain occupation which are working in the coal mine and asbestosis, these chemical factories, they're having more chances to develop transitional cell carcinoma of the urinary bladder. तो यूरिनरी ब्लैडर का सी है, आपको पता है एस्बेस्टोसिस और अदर फैक्ट्री वर्कर्स में ज़्यादा होता है, तो उसकी आपको इम्पॉर्टेंस का पता होना चाहिए। यू मस्ट नो अबाउट द इम्पॉर्टेंस ऑफ द ऑक्यूपेशन एंड आल्सो व्हाट इज इम्पॉर्टेंस ऑफ द residence. By asking from the residency, you may have idea about the hygiene of that area. If suppose patient is saying that I living at the DHA or I am living at the Beria town or hi-fi society, so you have idea about that this having a very good hygiene as compared to the other areas of this city. And there are the certain disease which are present in certain residents, certain regions of our country or in certain parts of the globe. For example, कौन सी disease हो सकती है? Let's we are sitting in Karachi and we are talking about the anterior Sindh, where there is a very hot temperature, more than 40 up to 50 degrees centigrade, and summer remains for 8 months. So what do you think? What problem they may get? Yes, recurrent UTIs and kidney stones. So kidney stones are more common in hot areas like Balochistan or anterior Sindh and certain parts of the Punjab. And kidney stones are least common in the hilly areas because there is a low temperature, patient having enough water to drink. That's why. So these all having the importance in regarding the history. You must know about the history when you are sitting in a urological OPD or you are doing emergency and you are taking history of the patient having the urological symptom. So all things you must know, each point having its own importance. Now, who gave the history? Sometimes patient are unable to give you history properly. So his attendants or her attendants, maybe his mother, his father, his sister, his brother or friend, he will tell you history. So at the end of the history, you have to write down that this history of this patient is given by this person, which is relative to this patient. ठीक है, ताकि आपको आइडिया हो। Then second component of the history. After his biodata, you will jump towards the chief complaint, present complaint. ठीक है, तो चीफ कंप्लेन या प्रेजेंट कंप्लेन में क्या होता है? जो भी हो, हम नेक्स्ट स्लाइड्स में डिस्कस करेंगे कि इफ वी आर टेकिंग हिस्ट्री ऑफ द यूरोलॉजिकल पेशेंट, सो व्हाट विल बी द चीफ कंप्लेंट, प्रेजेंट कंप्लेंट ऑफ द यूरोलॉजिकल पेशेंट्स। तो उसमें फिर हम पूरी वो लिखते हैं ना, प्रेजेंट कंप्लेंट, ये नीचे स्लाइड्स में आएगा। तो जस्ट रिमेंबर, प्रेजेंट कंप्लेंट के बाद सेकंड क्या आता है? Yes, write down in chat what is next component in history after present complaint, chief complaint। बायोडेटा हमने पढ़ ली, chief complaint पढ़ लिया, उसके बाद क्या आता है? Yes, yes, right, history of present complaint, HOPC, history of present complaint। Now in yes, history of present complaint, you have to take a detailed history of the present complaint। अगर patient presented with you that I have a burning micturition, so you have to take a detailed history regarding the burning micturition। What things will you ask? We will discuss in later slide। So the third component of history is history of the presenting symptom or presenting complaint। Then now, what are the common urological presentations? We are talking about the present complaint। तो कॉमन यूरोलॉजिकल प्रेजेंटेशन क्या हो सकती हैं? आप यूरोलॉजिकल ओपीडी में बैठे हो, आप यूरोलॉजिकल वार्ड में हिस्ट्री लेने जा रहे हो, आप इमरजेंसी में हो, वहाँ पे यूरोलॉजिकल पेशेंट आ रहे हैं, तो प्रेजेंट कंप्लेंट क्या हो सकती हैं? यस, यू कैन रिप्लाई इन अ चैट बॉक्स, ठीक है। तो क्या हो सकती हैं प्रेजेंट कंप्लेंट? पेशेंट यूरोलॉजी का पेशेंट है, तो आप एग्जाम बनाएं कि क्या क्या चीज़ें हो सकती हैं। जस्ट रिकॉल योर मेमोरी के पेशेंट अब, ठीक है। सो यस यस यस, सो नंबर वन प्रेजेंट कंप्लेंट विल बी दी पेन। अगेन यूरोलॉजी में भी पेन आएगा, पेशेंट कहेगा आई हैव पेन इन द लंबर रीजन। सपोज उसको स्टोन है, कुछ कोई डिजीज है, तो वो पेन इन लंबर रीजन आ सकता है, पेन ड्यूरिंग मिक्चुरेशन आ सकता है। तो पेन विल बी दी मोस्ट कॉमन कंप्लेन which patient present in the OPD। तो एक मरतबा पेशेंट ने कह दिया कि आई हैव अ पेन इन लंबर रीजन, आई हैव पेन इन द लोअर abdomen, or I have pain in micturition। So what are the things you have to ask? Yes, you have to ask detailed things about the pain। You have to ask about the site, you have to ask about the onset, you have asked about the character, you have asked about the severity, you have asked about the radiation, you have asked about the associated symptom, you have to ask about the time, you have to ask about the exaggerating और लिविंग फैक्टर्स। ठीक है, तो पेन के वही जो 7 कैरेक्टर्स हम पढ़ रहे हैं, 8, ठीक है। तो you have to ask either you are taking history of the patient in a medical ward or surgical ward or urological ward। Once patient tell you I have a pain, so you have to elaborate, you have to ask site। ठीक है, साइट, लेट्स किडनी पेन है, किडनी स्टोन पेन है, तो साइट क्या होगी? लंबर रीजन। हम इस पे भी आ रहे हैं डिटेल में। ऑनसेट, when pain starts, ठीक है। करेक्टर, what character of the pain, either it is pricking, it is graping, it is radiating, relieving, colicky। तो ये करेक्टर आप पूछ लेंगे। सीवियरिटी, ठीक है, what severity of the pain, radiation, pain radiates where, associated symptoms क्या है वो भी आप पूछेंगे। then time, duration, course and pattern, and exacerbation and relieving factor। Okay, so pain, now in when we are talking about the pain in urology, so pain may be renal origin, pain may be ureteric origin। Okay, what difference between the pain in renal origin and ureteric origin? What is difference इन पेन ऑफ रीनल ओरिजिन और यूरेटिक? पेशेंट कैसे प्रेजेंट करेगा? अगर रीनल पेन होगा तो पेशेंट किस तरह प्रेजेंट करेगा, अगर यूरेटिक पेन होगा तो पेशेंट किस तरह प्रेजेंट करेगा? यस, राइट। सो दिस इज पिक्चर, यू see the red area now, this red area is the lumbar region। so kidney pain, patient will tell I have a pain at the lumbar region। okay, if there is a ureteric pain, patient will tell you I have a pain in the left lumbar region which is radiating towards the penis or urethra। ठीक है, तो यूरेटिक पेन कोल्की नेचर में होगा और वो रेडिएट करेगा, और जो लंबर पेन होगा वो बैक पे आएगा। ठीक है बेटा। नेक्स्ट, यू मस्ट डिफरेंशिएट बिटवीन द पेन ऑफ द kidney and ureter origin from the pain originating from the problem in the lumbar vertebra. तो वो lumbar vertebra pain, it occurs and it goes down towards the both legs and whole upper chest और back ache. तो ये होता है, तो आपको ये differentiate करना आ रहा. Then vesical pain, it is a fixed point. Patient will tell you that I have a pain at the suprapubic region. I have a pain during micturition. Or he will tell you that I have a pain when at the tip of penis when I end the micturition. So these are characteristics point of the vesical pain. ठीक है, vesical pain vesical stone की वजह से हो सकता है, vesical tumor की वजह से हो सकता है. ठीक है, prostatic pain will be same as of vesical pain. ठीक है, it occurs in male with age more than 60 years. Again, testicular pain. So testicular pain, patient will tell you that I have pain in right testes or left testes. Okay, it will be severe in consistency. Usually testicular pain occurs secondary to epididymoarthritis, mild to moderate pain intensity होती है. अगर patient को testicular torsion हो गया है तो it is very sharp and very sharp pain. And other is the epididymal pain. It is pain fixed in टेस्टिस. ठीक है, एंड पेन जो है रेडिएट टू बैक पे जाता है आपका. नेक्स्ट हम आ जाते हैं अदर रिलेटेड टू स्टोन पैथोलॉजी. ठीक है, और पेशेंट हिस्ट्री पे आपको क्या देगा. एक तो आपको कहेगा कि आर यू पास दी स्टोन. पेशेंट बाजों का हमारी ओपीडी में स्टोन्स लेके आ जाते हैं पेपर में, टिश्यू पेपर में रेप करके कि सर मॉर्निंग में आई पास द यूरिन एंड इन बिटवीन यूरिन आई पास दिस टाइप ऑफ द स्टोन ना. So patient will give you history. There are the passage of the stone and previous treatment of the stone. He will also tell you that I have a previous stone and I took a treatment from the doctor and I passed the stone. Hematuria, once stone passes, it develops the urinary tract infection. One is cause of the hematuria, or there may be a malignancy in the kidney or urinary bladder. It may cause a hematuria. So other tissue patient tell you about the ब्रोंकियल इस्दमा अगर हो जाए, एलर्जी हो जाए तो वो पेशेंट भी बहुत ज़्यादा कफ करते हैं तो इनको बायलेटरल लंबर पेन होता है. ट्रॉमा की हिस्ट्री हो सकती है, लोअर यूरिनरी ट्रैक्ट सिम्टम्स जो हैं उसके साथ प्रेजेंट कर सकता है पेशेंट. नाउ डिटेल लोअर यूरिनरी ट्रैक्ट सिम्टम्स. लोअर यूरिनरी ट्रैक्ट सिम्टम के काजेस क्या हो सकते हैं. मेल अकॉर्डिंग टू एज ग्रुप एंड फीमेल अकॉर्डिंग टू एज ग्रुप. हम अभी डिस्कस कर चुके हैं कि if there is a patient having age more than 55 or 60 years, so the cause will be different. क्या cause होगा. benign prostate hyperplasia, BPH, prostate malignancy, which is more common. In younger age, urinary tract infection, vesical stone, urethral stone, ureteric clot. These are the symptoms present patient with the different age group. Female hogi, if patient is a pregnancy, then he may develop the urinary retention due to the grave pressure. Pregnancy की वजह से pressure होता है pelvic पे, उसकी वजह से हो सकता है. तो you must know the difference of the lower urinary tract symptoms in different age groups and according to different gender. Now we are talking about the lower urinary tract symptom, voiding obstruction. ठीक है, patient is not passing urine, unable to pass urine, जिसको हम कहते हैं obstructive symptoms. ठीक है, voiding symptoms or obstructive symptom. What will be the voiding symptom and obstructing symptom? Patient will give you history about the hesitancy. He is unable to pass micturition. Number one. Number two, loss of force and decrease of caliber of the stream. He is applying the pressure to pass the urine forcefully, but pressure of that stream is very low. Okay, it means there is some obstruction, maybe in urethra, in bladder, or so. Third thing is interruption of the urinary stream. He will pass urine in episodic manner. He will pass few ml, then he stop, then he pass few ml, then he stops. And then a terminal dribbling. At the end of micturition, there will be the dribbling of the urine drops. Then retention, acute and chronic retention may be voiding or obstructive symptoms. Storage, irritative. ठीक है, पेशेंट हैविंग अ मल्टीपल फ्रीक्वेंसी ऑफ यूरिनेशन विल इंक्रीज, ज़्यादा हो जाएगा. नेक्चुरिया, पेशेंट रात को बार बार यूरिन करने जाएगा. अर्जेंसी, पेशेंट हैविंग वेरी अर्जेंसी टू पास यूरिन. एंड अर्ज इनकंटीनेंस. तो ये सारे सिम्टम्स होंगे पेशेंट को ऑब्स्ट्रक्टिव यूरोपैथी में. पोस्ट वाइट सिम्टम क्या होते हैं? पोस्ट वाइट डिबलिंग होती है जब पेशेंट यूरिन पास करेगा, देयर विल बी दी पैसेज ऑफ द ड्रॉप्स ऑफ द यूरिन. इसको कहते हैं हम पोस्ट वाइट डिबलिंग. Then sense of residual urine. Once patient micturate completely, he came out of the washroom, he again thinks that I have a residual urine. He goes back to urinate. तो इसको हम कहते हैं sense of residual urine. वो कभी empty urinary bladder feel नहीं करेगा. ठीक है. So lower urinary tract symptom, other important points, you must टेक डिटेल हिस्ट्री. जो हम पास्ट मेडिकल एंड सर्जिकल हिस्ट्री लेते हैं उसमें आप डायबिटीज़ मेलाइटिस का पूछते हैं, डायबिटीज़ नेफ्रोपैथी होती है, डायबिटीज़ वाले पेशेंट बार बार यूरिन करते हैं, डायबिटिक वाले पेशेंट में यूटीआईज यूरिनरी ट्रैक्ट इन्फेक्शन इज मोर कॉमन. अ पेशेंट हैविंग डायबिटीज़ मेलाइटिस. यूरोलॉजिकल इंटरवेंशन may patient have a history that he or she have passed the Foley's catheter in previous episodes. That's why there may be the problem with the urological intervention. तो उसकी कॉम्प्लिकेशन हो सकती है बाद में. कोई पहले सर्जरी तो नहीं हुई, को पहले फोलिस तो पास नहीं हुआ, ये सारी चीज़ें होती हैं. देन हेमेचुरिया, पासिंग ऑफ ब्लड इन द यूरिन, ये आपने पूछना है. प्रीवियस यूरिनरी रिटेंशन तो नहीं हुई थी वो, ये सारी पास्ट मेडिकल हिस्ट्री में आपने सारी. ड्रग इनटेक कौन सी ली थी. कॉन्स्टिपेशन समटाइम्स कैन कॉज यूरिनरी रिटेंशन, तो ये भी आपने पूछना है. तो यू हैव टू टेक अ डिटेल हिस्ट्री of the patient present with lower urinary tract symptom. Okay. Incontinence, you have to rule out incontinence is true. What is the stress level of the patient, what is urgency, and paradoxes. Sometimes patient tell you that I am passing urine. He will not give you the history of the urinary incontinence or urinary retention. He will tell you that I am passing urine, but that urine is because of the overflow. You know about the capacity of the bladder, it is 300 up to the 1500 ml. अगर वो फिल भर जाए उसके बाद वो ओवरफ्लो करता है, इट ओवरफ्लो, और पेशेंट समझता है कि आई एम पासिंग यूरिन, बट दैट इज नॉट एक्चुअल यूरिनेशन, इट इज ओवरफ्लो ऑफ द ब्लैडर. Enuresis, maybe patient having some other disease such as renal shutdown or other organ failure, and he is not making urine. So you must take a detailed history to differentiate between enuresis and other things. Dysuria, burning urination होती है, तो ये आपको आना चाहिए. Nematuria, sometimes he will tell you history that when I am passing urine, I am also passing bubble of the airs, or I am passing the air. So this will indicate patient might have other problem. कौन सी हो सकती है? Yes, anyone of you can reply me in chat. If patient is complaining of nematuria, he is passing air, bubbles, flatus in urine, in between urination. What do you think? What will be the cause behind that? Yes. So cause will be the fistula between the colovesical, colon and vesicle. So from colon air, there is a very small opening, so it passes the air to the urinary bladder and it passes into the patient passes in urine. Okay, good. Other is oligouria. Due to the certain medical condition, patient may develop a small amount of the urine. Anuria, urethral discharge. So renal failure symptoms, when you will take a detailed history, you may differentiate these things from acute renal shutdown or acute urinary retention. Okay, so take a detailed history always. Hematuria, what are causes of the hematuria? Hematuria means blood in urine. ठीक है, sometimes patient passes gross urine, sometimes patient pass very small amount of urine. So what will be the hematuria? Hematuria cause may be in renal hematuria. Past cause may be the post-renal. Post-renal hematuria, the cause will be within the urinary bladder or urethra. Okay, so again, if patient is complaining of the hematuria, ठीक है, so we are talking about the present complaint. We discussed pain, we discussed the post-white symptoms, we discussed pre-white symptoms, we discussed lower urinary tract symptoms. Now we are discussing hematuria. This is also present complaint. Sometimes patient present with this complaint in OPD. So up again, you will start from age, residency, duration, occupation, painful hematuria or not. So इसकी importance say if it is painless, you will suspect of the CA. If there is a painful, then it may be due to the infection, UTI, cystitis, or pyelonephritis. So history of amount of bleeding, clot, shape of clot, trauma, bleeding from other sides, bleeding disorder तो नहीं है इसको कि वो हमारे पास हेमेचुरिया के लिए present हो गया है. He presented in our OPD with hematuria, but he has already a hemorrhagic disorder. He is bleeding from nose, anus, and we are focusing on the urinary system. So take a detailed history. Again, family history, malignancy और hematological disorder. Drugs तो कोई ऐसी नहीं ले रहा जिसकी वजह से bleeding हो रही है. Food, smoking, ये सारी चीज आपने पूछनी है. Then history का next component है systemic review. You have to ask about the few questions regarding all system. CNSA, CVSA, आपका respiratory system है और उसके साथ फीवर, वेट लॉस का, लोकोमोटर, ये आपके जो 5 सिस्टम है, 5 सिस्टम, you have to ask these 5 systems. Past history is important, which is same as you asking this history in different wards. Okay. Family history, again similar condition है, diabetes है, hypertension है, bleeding disorder की history ये पूछेंगे. Thank you very much. और कोई भी क्वेश्चन हो तो आप मुझे पूछ सकते हैं, इसमें चैट बॉक्स में पूछ सकते हैं अगर कोई क्वेश्चन है तो. Okay, so let's end our presentation. Thank you very much. Thank you all of